Hello everyone, welcome to MRI Knee Made Easy series. In this video tutorial, I will be showing you some of the cases of MRI knee. So the first case is 15-year-old male who presented with a palpable lump in the medial aspect of lower thigh, and this is the coronal PD fat sac, and we can see a bony projection arising from the junction of diaphysis and metaphysis of femur, and this is projecting away from the joint. So we can see this bony projection, it is pointing away from the joint line, and the cortex and the marrow are seen continuing into the lesion. So this is a benign osteochondroma. We can also measure the thickness of the cartilaginous cap overlying this lesion. So let's measure the thickness. The thickness measures approximately 7.4 mm. And this is normal. If it is more than 20 mm, or if the lesion is showing interval growth, or if there is compression of the neurovascular structure surrounding it, then we can suspect the development of chondrosarcoma within it. So this is a case of osteochondroma, and seeing on the other images of this patient, we can note the presence of this area, this abnormal area of signal intensity in the posteromedial femoral metaphysis at the origin of medial head of gastrocnemius. So what is this lesion? This is cortical desmoid. Cortical desmoids are do not touch lesion. They are benign lesion, and they are because of chronic avulsive stress at the origin of medial head of gastrocnemius and insertion of adductor magnus. And we can also note this on the sagittal PD fat sac. So this is the cortical desmoid, and they are generally discovered incidentally. So this MR was performed for osteochondroma, and the cortical desmoid is diagnosed incidentally on this. And they are generally seen in adolescent people. So this patient is also 15-year-old, and we can note the presence of cortical desmoid in this MRI. Let's move to the next case. This is a case of 6-year-old female who presented with swelling in the knee joint, and this is the sagittal PD fat sac, and we can see there is presence of joint effusion and synovial thickening, and multiple synovial masses are noted with presence of hypointense lining in it. So what can be this hypointensity? It is because of hemosiderin deposition. We can see other sequences. This is the T2 weighted sequence. So the effusion is appearing hyperintense, and the synovial lining is showing areas of hypointensity. So there is presence of hemosiderin deposition within the synovial lining. So this is a case of diffuse pigmented villonodular synovitis. So PVNS or pigmented villonodular synovitis is basically a monoarticular and condition, and it is more commonly seen in the knee joint. They are generally seen in the adult population, but very few cases are seen in the pediatric age group. And this is a 6-year-old female, and she has presented with PVNS. So this is a very rare entity in the pediatric age group. We can also see the axial plane and see how beautiful the synovial lining is appearing. And there is presence of hemosiderin contents within the synovial lining. There are no obvious erosions in the present scan. So actually PVNS presents with multiple pressure erosions in the underlying bone, but the pressure erosions are not seen in this case right now. We also have a contrast sequence. So this is the sagittal postgadolinium T1 weighted sequence, and we can see intense enhancement in the synovial lining. So this is a case of diffuse PVNS involving knee joint in a pediatric patient. Let's move to the next case. This is a case of 27-year-old female who presented with palpable lump around the medial aspect of knee joint. Let's see this case. The axial GRE sequence, and we can see multiloculated cystic lesion is noted along the medial retinaculum. and there are no evidence of any solid component within it. So this is a multiloculated cystic lesion along the medial retinaculum. So this is a ganglion cyst. We also have a post-contrast sequence. And on post-contrast sequence, we can see there is peripheral thin enhancement of the lining along the ganglion cyst. So there is no any solid component. There is no evidence of any solid component. And so this is a simple ganglion cyst. Ganglion cysts are generally formed in relation with the joint, tendons, ligaments, and other structures surrounding the joints, and they generally have a connection with the joint by a small neck. So this is a ganglion cyst, multiloculated ganglion cyst along the medial retinaculum. Let's see other structures. So the menisci are normal, cruciate ligament is normal, and rest of the knee joint is completely normal. So this is just a ganglion cyst along the medial retinaculum. Let's move to the next case. This is a case of 23-year-old male patient who presented with palpable lump along the lateral aspect of knee joint. So as we can see, there is presence of a hyperintense multiloculated, multilobulated lesion involving the subcutaneous plane of the knee joint, plus it is also infiltrating deep to the ligamentous structures on the lateral aspect of knee joint, and this lesion is extending in the knee joint cavity. We can see that in axial plane. So you can see there is an infiltrative lesion having solid component, and this is infiltrating the iliotibial tract. This is the iliotibial tract, and this lesion is infiltrating the iliotibial tract, and it is getting inside the joint cavity, and it is reaching here up to the hopper fat pad. So you can see presence of this lesion within the hopper fat pad. We also have sagittal PD fat set. Let's see the sagittal PD fat set. You can see presence of infiltrative lesion within the hopper fat pad, and the bulk of the lesion is extra-articular, but it is also extending within the joint. Let's see on post-contrast sequence. So this is the post-contrast sequence, and unlike the ganglion cyst, which was showing peripheral enhancement, this mass is showing diffuse heterogeneous enhancement involving the periphery as well as the central component of the mass. You can see the axial plane. So there is diffuse heterogeneous enhancement, not only involving the periphery but also the central component of the lesion, which suggests that this is a solid mass. So the diagnosis in this case was synovial sarcoma. Synovial sarcoma are generally slow growing soft tissue neoplasms, which are most commonly seen surrounding the knee joint, and they start from the structures around the knee joint. They are generally seen outside the knee joint cavity, and intra-articular extension is rare in cases of synovial sarcoma. But in this case, we can see that the lesion is infiltrating in the joint also. So this is a case of synovial sarcoma. We can also see presence of foci of blooming, which suggests areas of calcification within the synovial sarcoma. And the histopathological examination is the definite method of diagnosis in such cases. So this is a case of synovial sarcoma. Let's see other structures in the knee joint. You can see the menisci are normal, and the cruciate ligament is also normal. The extensor mechanism is normal, and the bones, femur, tibia and patella are also normal. So this is a case of synovial sarcoma. We have to give extension of the mass. We have to report the infiltration of the structures which are involved. Let's move to the next case. This is a case of 25-year-old female who presented with vague pain in the right knee joint, and this MRI of the right knee was performed. As we can see, the lower end of femur and the upper end of tibia are normal. The cruciate ligament are normal. We can see the lateral meniscus is completely normal. This is the medial meniscus, which is also normal. You can see the extensor mechanism, including the quadriceps tendon, patella and patella tendon are normal. And this is the area where the abnormality is located. So this is a soft tissue mass which is appearing hyperintense on PD fat side, and this is well-defined lobulated lesion which is located in the posterior aspect of upper fat pad. Let's see the signal intensity on other sequences. So we have a T2-weighted sequence, and the lesion is showing areas of hypointensity on T2-weighted sequence. We also have a GRE sequence in this, and we can see multiple foci of hypointensity in the lesion. You see the axial plane, the axial sequence, and you can see presence of a well-defined lobulated lesion just inferior to the patellococlear junction. We also have a contrast sequence. So on post-contrast T1-weighted sequence, we can see the lesion is showing diffuse heterogeneous enhancement. So the lesion is well defined, lobulated. It is appearing hyperintense on PD fat side, showing areas of hypointensity on T2-weighted sequence and on GRE. So this is a case of focal pigmented villonodular synovitis. So this is a classic location for focal PVNS. Focal PVNS are most commonly located within the posterior aspect of upper fat pad, and this is a classic imaging appearance of focal PVNS. So PVNS are of two types: the diffuse one, which involves the joint cavity as a whole, which presents with diffuse synovial thickening and hemosiderin deposition, and the other variant is the focal PVNS, in which we see a focal mass within the joint, and it shows areas of hemosiderin deposition. However, the amount of hemosiderin deposition in the focal PVNS is less than the diffuse PVNS. So we will see less amount of blooming on focal PVNS. PVNS can also be seen in relationship with the tendons, in which it is known, in such cases, known as giant cell tumor of the tendon sheath. So these are all varieties of pigmented villonodular synovitis. So I showed you some cases, some interesting cases of MRI knee. I hope you have enjoyed the video. Thank you.